Let us discuss today about substance abuse after bariatric surgery. Now, is bariatric surgery making the patients prone to develop a substance abuse? The data suggests that patients after bariatric surgery and losing a lot of weight are in a state of euphoria, elation. But some of them do go in a state of depression because of not being able to eat or consume that much amount of food. That is where the role of a good post-bariatric surgery counselling comes in. These situations may make a person prone to have substance abuse. At the same time, there are individuals who are consuming alcohol, smoking cigarette or chewing tobacco in huge quantities before surgery. What do they do after surgery? These are the two very important issues which I would want to address today. The first issue, whereupon a person was not smoking, not chewing tobacco, not consuming restricted substances or drugs, and not drinking alcohol, is prone to start it after bariatric surgery. We have to take good care of the patient, good counseling, regular follow-up, and love, tender and care with good support will prevent them from going into a substance abuse. At the same time, those who were consuming alcohol and were smoking or chewing tobacco should stop it after the bariatric surgery. Chewing tobacco or smoking a cigarette is much more dangerous than consuming alcohol after bariatric surgery. Chewing tobacco gives rise to several forms of malignancies, starting from oral cancers to cancers of GI tract to lung cancers to other malignancies. At the same time, both chewing tobacco and cigarette smoking cause lung cancer and cancer related to gastrointestinal tract, and some may also cause cancer related to brain and other parts of the body. Cigarette smoking has been linked to 55 different forms of cancers inside the body. If we leave aside the risk of cancer, cigarette smoking is also dangerous because it induces marginal ulcers in the pouch of the stomach and the anastomosis at the gastrointestinal site. These marginal ulcers may cause epigastric pain to the patient, vomiting, severe discomfort, and God forbidden, if they tend to perforate, it may lead to an abdominal catastrophe and a surgical emergency. So, I would request all of you, guide and advise upon stopping any form of substance abuse, consumption of alcohol, and strictly smoking cigarette after bariatric surgery. Smoking cigarette after bariatric surgery has led to a lot of complications, and therefore our advice would be to stop it. Alcohol consumption is also not advisable because it may increase the weight after bariatric surgery. When we consume alcohol, the amount of food which we consume is 4 times to 5 times, because most patients would not realize the amount of food they are consuming after they have consumed alcohol, and the pouch dilatation, the enlargement of the pouch after bariatric surgery may take place because of that. On the other hand, if after consumption of alcohol, the patient is dehydrated, it may cause permanent liver damage. So the right kind of the advice would be to completely cease cigarette smoking and alcohol or reduce the quantity. We always say that bariatric surgery is a life-transforming, a life-changing and a life-saving procedure. It is a new lease of life which any patient would get after bariatric surgery. He would not only lose weight, but also would get rid of all the complications of obesity, the diseases associated with obesity like type 2 diabetes, hypertension, sleep apnea and many others. So let's not spoil the life which you have regained after undergoing such a crucial surgery. Stop smoking, stop alcohol for a healthy and a better life after bariatric surgery. Thank you very much.